Good morning, everyone. Welcome to episode 9 of Wake Up with Walters. This morning, we're going to be talking about Brazilian butt lifts and why surgeon experience matters. So we'll wait a few minutes, get everyone to join the live session, and then we'll start talking about Brazilian butt lifts. Hope everyone had a good weekend. Hopefully, as far as, elective plastic surgery, hopefully we only have about 2 more weeks of this. Hopefully by May, we're able to start operating. So if you're interested in having a procedure, or you already have a procedure scheduled, just stay close contact with my office and we'll be updating you really every day on when the Louisiana Department of Health is going to allow us to start operating again. So again, let's wait a few more minutes, and again, we'll talk about the Brazilian butt lift, why surgeon experience matters. A very popular procedure these days, and I think it really it's very important for you to see someone not only who is a board certified plastic surgeon, but also who has a lot of experience in this procedure to optimize your results post-operatively. And the main thing that we'll go over as well is, I think Brazilian butt lift, it gets a bad name just by the name of the procedure itself, and so people automatically think really excessive size of the butt, and that's really not the case. We can do really very natural Brazilian butt lifts or natural fat grafting to the butt, really to improve not only size but mainly shape. And so I do a lot of that with my tummy tucks, where we add fat to the outer buttock, and it's really not for size, it's for shape. And so a lot of times when I tell women, let's add some fat to your buttocks, when they weren't really kind of thinking about that, they get a little bit turned off. And it's my job to kind of teach them during the consultation and show them pictures, and then usually once we have that education, they understand why it can be beneficial for their overall result. So let's wait a few more minutes and we'll get some people on, and then we'll start. And again, if you have some questions, we'll take some time at the end and we'll answer some questions. And we'll go over, so we'll start with a brief overview on really what a Brazilian butt lift is, and then we'll talk about why you should really see a surgeon who has extensive experience. We'll go over what occurred around 2017 with the Gluteal task force to really promote safety in Brazilian butt lifts. And then, I'll kind of give my own take on how I perform the procedure, what I do post-operatively for my patients, and then we'll go over just a few results from my website. And mainly it's really to just show you that it doesn't have to be excessive size, and we can it's really a procedure for most patients looking to improve their overall shape. All right, so let's start. Okay, so what is a Brazilian butt lift, and really what is it? So, I think now in 2020, as opposed to, when I was growing up with Baywatch, there was a real emphasis back when I was growing up on breast. And, really with, I think, the advent of the media and TV, everything was, with Baywatch was big breast. And we've seen the trend with breast over the years to kind of go to be more of a natural size for breast. But that's been a little bit different for the buttocks. And, fuller, rounder buttocks has been really all the rage these days. And some of that has been fueled by social media, magazine covers, and celebrities. And so, there's some celebrities and some famous people who are just genetically blessed who have, beautiful, large buttocks, but a lot also have undergone this popular procedure called the Brazilian butt lift. And I think that's where, sometimes people get the negative connotations of the Brazilian butt lift because they just think of people and, celebrities who have gotten it really, really large. And so, what exactly is it? It's really, liposuction to all areas of the body. Most commonly, though, the abdomen, the waist, the back, sometimes the thighs. And then that fat is collected, prepared, and then injected into the buttocks for overall size and overall shape. And so, like anything in plastic surgery, the reason that experience matters is because there's not really one standardized way to suck the fat out. There's really not one way where surgeons prepare the fat, and there's really not one way, or at least up until a few years ago, there was not really one recommended way on how to inject the fat back into the buttocks. And what has occurred over time is that there's been some complications, and even complications that have led to death. So experience does matter. And the reason for that is because of all the things that I just said. And if in the wrong hands, the fat can be injected into the wrong area, and it can then, ultimately end up into the veins of the buttocks. So something called the gluteal veins. And if those veins are injured, then fat can get into the vein and then can travel up to the heart and the lungs. And so in 2017, a multi-society gluteal fat grafting task force was developed because in 2017 alone, there was 3 deaths in Florida from this procedure. And so it was estimated at that time that 1 out of every 3,000 could result in a death for the Brazilian butt lift procedure. And that's the highest known for any aesthetic procedure. And so, as board certified plastic surgeons, we took that very seriously, and something really needed to be undergone to see what exactly is happening. Well, number one, again, like we talked about a few weeks ago, in order to perform fat grafting to the buttocks, you really don't have to have any formal training. And so you can be, you can graduate medical school, be any type of doctor, go do weekend courses, and then, in your office or in your surgery center, like outside of a hospital setting, you can call yourself a cosmetic surgeon, and then you can start doing Brazilian butt lifts. And what was happening and what we were noticed from that gluteal task force was that fat was being injected deep below the muscle. And we'll go over a few anatomy slides in a second. But when fat is injected below the muscle, that then there's pressure on the gluteal veins can then be injured, and then fat can go to the heart and to the lungs. And I'll show you kind of what I mean by that exactly. So, okay. So here in this picture, you can see at the bottom, they have something called the superior gluteal vein. And if you look at the chart, that gluteal vein is fairly large. I mean, those gluteal veins are fairly large, and if injured, fat globules can get into that vein, and then what happens is it gets into the main vein. And so you see the main vein called the inferior vena cava. That has direct access up into the heart. And so you can see, see if I can. You can see that the blue goes straight to the heart. Well, the heart's connected to the lungs as well. And so what happens is that fat then acts as like a blood clot to the lungs. So it's not a blood clot, but it's a fat clot. And that then disrupts the pulmonary circulation and can cause a fatal event. So again, what we noticed in that gluteal task force was that, on all the patients that potentially died, there was fat in the gluteal muscles, there was fat beneath the muscles, and there was damage to those veins. And what was then seen is that massive fat emboli was in the heart and the lungs. So, from that, and that was a gluteal task force that was tasked by the American Society of Plastic Surgeons, the American Society for Aesthetic Plastic Surgery, of which I am members, the International Society of Aesthetic Plastic Surgery, and two other international societies on fat grafting. So all of the experts of the world came together to give some recommendations, because obviously when you're undergoing elective cosmetic surgery, we want the risk of death to really be close to zero as possible. So what we suggested as all of these societies is that you need to stay as far away from the gluteal veins as possible. And fat should only be injected in the subcutaneous plane. And I think most board certified plastic surgeons who are well trained in this procedure can easily detect where they are when they're injecting fat into the muscle. And so we only inject fat above the muscle in the subcutaneous plane. And then the other things that were recommended is that at all times, you have to concentrate on the position of the cannula tip. So you have to know where, and you should be able to feel where that tip of the cannula is every time that you're, passing that cannula through the buttocks and while you're injecting fat. And then there was some recommended access incisions, and to, again, best allow for superficial placement of the fat. There was also some recommendations on instrumentation, and so there are certain types of cannulas that, if you're not a board certified plastic surgeon following these recommendations, then maybe you're not properly notified and trained on what is the safest instrumentation for you to use, because there's a whole wide of different tools that we can use to not only suck fat out, but in order to also inject fat. So we recommended avoid bendable cannulas, avoid cannulas that have what we call Lurlock connections. And then again, we also recommended that injection should only be done while the cannula is in motion, again, in order to avoid high bolus injections, because, God forbid, if you are deep and you just inject a huge bolus of fat and that goes into the gluteal vein, and that can cause a major problem. And, we also recommended that, the risk of death should also be discussed with patients. With that, I think if you follow all of those techniques, the risk of death from a Brazilian butt lift should be, approaching zero. And, that's all with proper training. And so that's why, when I talk about the title of this talk, Why Surgeon Experience Matters, well, for most cosmetic surgeries, it's mainly just for, how do you experience matters so that you can optimize your best cosmetic result. For this procedure, if done in the wrong hands and untrained hands, it can be deadly, and that's unacceptable. All right, so again, this follows basically everything on my blog. So on my website, drjuleswalters.com, we have several blogs, so you can go back here and read this if you want. And it's, the blog is entitled The Brazilian Butt Lift, Why Surgeon Experience Matters. So again, up-to-date techniques. So let's go over that again. So there's so many different techniques on how we harvest fat, how we process fat, and how we re-inject fat. So I use what's called the PALS system. So it's power-assisted safe lipo techniques. Safe lipo techniques were developed by a surgeon and friend of mine in Shreveport, Simeon Wall. And all of that is really to kind of provide smooth liposuction areas to get fat out in an efficient way. And then what I use is the Wells-Johnson auto grafter. So basically, the fat gets collected into a syringe. We then decant or get some of the liposuction fluid out of the fat itself, and then that promotes more purified fat. And then once we're ready to inject, we're able to inject with the vibration system. Again, the vibration system allows us to kind of feel exactly, gives us another tactile sensation on where exactly we are injecting. And we also know that the inner medial quadrants, that's where kind of the danger zone is. So, sometimes we don't even have to inject in that area. So when I'm doing a tummy tuck, a lot of times I'm just injecting to the outer buttock. And that is a very, very safe zone. So sometimes patients, will ask me, well, what's the risk? And it's very, very low, because that is a very, very safe zone. So, okay, so that's really more for all the safety. So I think if you see a board certified plastic surgeon and he has extensive experience in the Brazilian butt lift procedure, then I think, number one, that is, you should feel very safe that your risk for any type of lethal complication should be fairly low, and that should be approaching 0%. But then in order to optimize your overall cosmetic result, that surgeon has to have an eye for the results that you're looking for. I prefer natural looks. I think also with one round of fat grafting to the buttocks, it's very hard to get a very unnatural look. I think most of the time when patients are expecting unnatural looks, or they see things on other websites or other Instagram pages, and they really want that unnatural look, sometimes they're looking at the early post-op result. And so how the result looks at 1 week to 1 month to 3 months is totally different. And so that's something that, in the consultation, we have the patient kind of talk about their goals, show me wish photos, and then we talk about whether it's going to need, one round of fat transfer or something that I call a round 2 BBL. And sometimes to get as large as some patients want, number one, they have to have enough fat, and number two, we have to do that with a 2 fat transfer process in order to safely transplant the fat. So, again, the main thing for that is, once you kind of are deciding on your surgeon, you need to look at pictures, not only on the website, but in the office. Not all of our patients allow us to use their photos. So we have more photos in the office for patients to look at. And, you have to make sure that, the surgeon's aesthetic eye meets what you're trying to accomplish. Okay, so we'll move on to post-op recovery. So, this is all surgeon dependent, and there's really not a lot of science for this, but I'll just tell you, my approach and what makes sense for me. When I'm doing a full Brazilian butt lift, so I'm placing fat, all over the buttocks, not only to the hip dips, but also to give projection. I have my patients, anytime they sit for at least 2 to 4 weeks, they are sitting on a Brazilian butt lift pillow that we provide for them, and that really just takes the pressure off of the buttocks. And these are for patients that I'm really trying to maximize as much fat survival as I can in order to give the result that they're looking for. Over the first 2 weeks also, again, if we're doing the full BBL, I'm having them lay on their stomach for about 2 weeks. And really that is just to kind of, allow those fat cells, as many fat cells as we can, to survive the transplantation process. We know that everything that we inject is not going to survive. That's just not the nature of the procedure. We quote patients on at least 50% survival. I think most of the time we get more than that, but it's at least a 50% survival of the fat. During that initial kind of 1 month follow-up, not only do you lose a little bit of fat, but from the time that we leave the operating room to that first post-op visit, there's a lot of swelling. So sometimes patients will say, "Oh, I think I lost all the fat." That's not necessarily the case, because you lost some of the swelling, as well as up to 50% of the fat. And I think most of the time we get more than the 50%. So really for the first 4 weeks, I encourage my patients no heavy lifting, no strenuous activity. It's 2 weeks trying to stay off their buttocks as much as possible. Anytime they sit, they sit on the pillow that we provide them with, and when they sleep on their stomach. After about 4 to 6 weeks, they are then able to start, getting back to routine, heavy lifting and some strenuous activity at that point. I do encourage, I think it takes about 3 months for the fat cells to really stabilize and to let the swelling go out, and to see exactly what type of fat take that we achieved. So after about 3 months, that's when I tell the patient they're good to start, a squatting program and build up the muscle to now optimize the results. During that first 3-month process, I tell them to stay away from, extensive cardio type procedures where you'll be burning fat, and really just wait until we can judge how much of fat survival we have achieved. And I think, again, once that's the case, then we talk about, where do we want to go? Are we happy with the results? Do we want to get a little bit more projection naturally? And that would be a squatting program that we recommend them do. Or are they ready for a round 2 BBL? Okay, so a huge part also is understanding what is possible. Social media is great. Obviously, you guys are all, on this live session this morning because you like social media. But there are so many pros of social media, but the cons of social media is that there's a lot of photoshopped results and there's a lot of misinformation out there. Some surgeons are photoshopping results. They're only showing kind of on table results when the buttock is fully injected. Sometimes there's misleading angles. The operating room table is bent to make the butt appear larger than what it is. And then sometimes there's results only shown in the early postoperative period. And that really kind of, misleads patients to expecting, results that sometimes are not attainable with one round of fat transfer. So when you're looking for a Brazilian butt lift surgeon, make sure you're seeing long-term results. You should see everything. And, I enjoy posting pictures in the operating room a few weeks postoperatively, but, not only just the early results. I like to show the 3-month, the 6-month, the year, and even before, after that. So, you have to understand what is possible and really communicate effectively with your surgeon so that you're happy with the result, postoperatively. Okay, let's go through let's see if I can move this. Okay. So, these are all of my website, and you can see that you can't see the other one because I'm blocking it. I don't know how to fix that. But anyway, look at the bottom picture. So part of the Brazilian butt lift is not only functioning, focusing on the buttocks itself. It's really doing, great liposuction to the waist, and you want to get all of the body parts to flow smoothly. And so you can see for her, we've achieved, definitely better shape, better size, in what I think is a natural result. It's definitely noticeably bigger, but it's a natural result. And that's I think that is a 1-year post-op result. So there's some surgeons and some patients who say, oh, fat transfer doesn't work, and I think right there you can see that obviously that's no swelling is involved. It's over 1 year post-operatively, and we have a better contour, better curve, all in a natural way with no implant. And I think that's something that I attain for results. Okay, here's another patient. Again, let's kind of look at the bottom one. Again, you can go to my website and see all of these results. Same thing. I'm sorry for the pre-op on the bottom. She has a bra in place, so that makes that roll look a little bit worse. But you can see above, she has no bra, and what we've done there is really done liposuction really from her shoulders, all the way down to her buttocks, and was able to really kind of create that curve. So the takeoff from the buttocks to the waist, all again in what I believe is a natural result. You can see just better definition of the back, better definition of the buttocks, again, all in a natural way. And this, all of these results are at least 3 to 4 months post-op. Okay, so here's another lady, and again, let's focus on the bottom picture. You can see that we really just kind of transformed her shape. She was obviously in good shape, had a good buttocks to begin with, but we did liposuction just like the last lady, from her top, upper back all the way down to the buttocks, the waist, really focused on the waist. And that's a way that even for patients that don't have a lot of fat, doing properly liposuction to the waist, it makes the buttocks look bigger without even placing fat. And so what we're trying to obtain is just that nice smooth kind of curve, that nice smooth S curve from the waist to the buttocks, again, all in a natural way. And I think we achieved that on her. Here's from the posterior view. So again, nothing too unnatural. I'm always thinking proportions for patients. How can we make the proportions fit that body? And again, liposuction from the upper back all the way down to the waist, really kind of brought in the waistline in a natural way, and added fat to the outer buttock as well as the whole buttock in order to obtain projection. Okay, so I chose this patient as well because people sometimes think that Brazilian butt lifts are just for excessively large buttocks, and it's really not. We can really just, even in skinny patients, do liposuction from head to toe, take that fat and use it in a targeted way to improve the overall shape. So pay attention especially to the lower back, to the outer buttock region, and in a very natural way we were able to improve her contours and improve her curves. And this is something that she was unable kind of to do in the gym alone. And so even for patients who are not looking for an unnatural result and really don't have a lot of fat, we can a little fat can go a long way in patients of all shapes and sizes. Okay, and that's really just kind of a continuation of what we were just talking about. This patient really didn't like the flattening of her outer buttock. And if you look at her, she's in good shape, doesn't have a lot of fat, and so for her, this is really something all about shape. And it's really not for size. It's to, do targeted liposuction to her waist and her back, and take that fat and add it to the outer buttock, again, to improve the overall shape. Now, you'll notice something that patients talk about a lot and inquire about is cellulite. For the most part, cellulite is very hard to treat. If you have cellulite before, you're going to have it post-operatively. There are some special techniques that we can do during the surgery to try to lessen it. But I tell patients, if we do improve it, then that's just an added bonus. Don't expect it, because there are so many, genetic, hormonal, and causes for liposuction that it's very, very difficult to treat. And every woman has it, and so every celebrity for the most part has it. Things are photoshopped, so don't go by everything that you see on social media. So again, here's the posterior view, And you can just see that we've added enough fat to change her overall shape. Nothing unnatural looking, but something that gives her something that she couldn't obtain in the gym. Once you have those hip dips, genetically or from a lot of diet and exercise, it's very hard in the gym to expand that area. And really the only thing that can expand that area is surgery, and that would be fat transfer to that area. Okay, just multiple examples of very natural results. And so, this is something that I really just wanted to stress in this session, is because I think a lot of people just think that Brazilian butt lifts are excessively large buttocks, and that's not the case. We talk about fat transfer in almost every procedure that we do, from facelifts to breast to tummy tucks to buttock augmentation. And so it really just allows us to kind of shift fat around during our cosmetic procedures to perform overall better results. So this patient plus or minus may have come in just for liposuction, and then I talked to them about the possibility of us doing a fat transfer, because it takes our liposuction results just to the next level in order to kind of place fat in strategic areas in order to overall improve their shape. Again, another example, and these are all longer term results, at least 3 months and above. And so you can just see right here, again, the top picture as well as the bottom picture is that we've changed her overall shape. And so she went from having a very flat appearing buttocks and was having trouble kind of building that up in the gym. And we've done targeted liposuction of her abdomen, her waist, her back, and really taken that fat and transferred it to the buttocks. Again, not only for size but for overall shape. And something, my goal is for these patients to walk on the beach, or to be in a dress, and for people not to know that they undergone a fat grafting procedure. And I think most of the patients that we saw today, it didn't look that they underwent plastic surgery. And I think that is really kind of a win-win situation for everyone. Okay. So, again, to conclude, safety is number one. Really, you have to do your proper homework. Find a board certified plastic surgeon. So we talk about this a lot. American Board of Plastic Surgery is the only board that certifies plastic surgeons, and that's the minimal criteria that you should do. Once you find a board certified plastic surgeon, you need to look at multiple before and after photos, visit with that surgeon, and make sure that you guys are agreeing upon the results that you want to obtain. Okay, any questions? All right, well, if there's no questions, again, we'll be kind of doing this most days, Monday through Friday, at 9 o'clock Central Standard Time. So if you guys have any topics you want me to address, feel free to DM me, and we'll see about having that as a topic one day. I hope everybody has a good day, and we'll see you tomorrow.